All right, let's jump right into anti-amoebiasis drugs. We're going to cut through all the fluff and give you just the essential facts you absolutely have to know for your nursing exams and, of course, for your practice.
So, you're studying for your exam, and a question on metronidazole pops up. What are the key must-know facts that you just can't afford to miss? Well, let's get right into it.
Okay, first things first. We have to understand the main category of drugs we're even talking about here. These are the tissue amoebicides.
So what are they, really? Just like the name says, these are the drugs that get to work deep inside the body. We're talking in the tissues, the liver, and the intestinal wall. This is exactly where that invasive amoebiasis likes to cause all its damage.
I want you to think of these drugs like they're on a winner's podium. In that number one spot, you've got metronidazole. It's the absolute go-to for acute cases. Right behind it is Tinidazole, which is pretty similar but often a little easier for patients to tolerate. And then way over on the side, you've got Emetine and dihydroemetine. These are only brought out for the most severe cases, and that's because of one huge risk. They can be toxic to the heart.
Knowing when to give a drug is one thing, but knowing when not to give it, that is absolutely critical for patient safety. So let's cover the key contraindications.
Here are your big red flags. The most important one, and you're going to hear me say this again, is absolutely no alcohol with metronidazole or tinidazole. It's a huge deal. Also, you're going to want to avoid metronidazole in the first trimester of pregnancy. Be super cautious with patients who have severe liver disease. And because of that cardiotoxicity risk we just mentioned, Emetine is a total no-go for anyone with heart disease.
Okay, so you've administered the drug safely. What are the potential adverse effects you need to be watching out for in your patient?
You know, patients will often complain about nausea and a really distinct metallic taste in their mouth. It's also super important to tell them that their urine might turn a dark color. This is actually an expected side effect, so they don't panic. But there it is again, the disulfiram-like reaction. This is that dangerous, violent reaction that happens with alcohol. And while it's pretty rare, you should also be aware of the potential for neurotoxicity.
All right, we've talked about the what and the why. Now let's get into the how. These are your essential nursing actions. This is your playbook for taking care of a patient on these medications.
Here's your checklist. Number 1, keep the patient hydrated. Easy enough. 2, remember that for a complete cure, you often need 2 types of drugs. A tissue agent like metronidazole plus a luminal agent to clear out anything left in the gut. 3, if that high-risk drug Emetine is being used, you have to monitor cardiac function. It's not optional. 4, if there's any concern about spreading it, partners may need treatment too. And finally, you always confirm the cure with a follow-up stool exam. Don't just assume it worked.
Listen, if you only remember one single thing from this entire explainer, please let it be this. This is the most critical safety warning you will ever give. Absolutely no alcohol with metronidazole or tinidazole. The reaction is severe. We're talking intense nausea, vomiting, flushing, or racing heart. This warning is completely non-negotiable.
So how are you going to lock this critical piece of information into your brain so you don't forget it on exam day? Let's use a super simple memory tip.
Here it is. For your exam, just remember the metro rule. Think of metronidazole. Now just picture a really bad, chaotic trip on a metro train. That's exactly what happens when you mix this drug with alcohol, a chaotic and dangerous reaction. Metronidazole plus alcohol is a bad trip. No exceptions. It's a simple little rule, but it's one that's going to protect your patient every single time.